Our first speaker is Dr. Carolyn Runowicz, a leader in the battle against women's cancer and a breast cancer survivor herself. Dr. Runowicz is the Executive Associate Dean of Academic Affairs and Professor in the Department of Obstetrics and Gynecology at the Florida International University Herbert Wertheim College of Medicine. She was the first breast cancer survivor to serve as president of the American Cancer Society and the first female president of the Society of Gynecologic Oncology. Dr. Runowicz also has an expertise in the intersection of healthcare delivery and healthcare policy, having served a 6-year term on the National Cancer Advisory Board and having testified before the U.S. Senate. We are pleased to have her here with us tonight. Please welcome Dr. Carolyn Runowicz.
So we have panelists that are going to talk to you about diet, nutrition, exercise. And now take a look at me. I am not obese. I exercise like a mad fiend. I starve myself. And yet I told you that I had, or someone told you, I think you told us that I had breast cancer. So obviously diet and exercise are important. Genes are important. However, now listen to this. Most women who get breast cancer do not have a family history, yet breast cancer is genetic. So I've totally confused you. What it means is that you get a mutation at the gene level, but it doesn't have to be inherited. I have no breast cancer in my family, and I will have patients who say, how did I get cancer? It doesn't run in my family. 90 to 95% of my patients, of all patients who get cancer, do not have a family history. So if you have a family history, you want to know it, and if you're eligible for genetic testing, you want to do it because we can do things to prevent breast cancer. One of the testimonies that I did in front of Congress was about mammography. And the latest brouhaha was the United States Preventive Services Task Force. And they came out and they had not analyzed any new data. They reanalyzed the old data that we all had analyzed. American Cancer Society had analyzed it, all other meta-analysis, the Cochrane group, all these groups analyzed it, and unequivocally, now the U.S. Preventive Services didn't say this, but unequivocally, age 50 and above, mammograms save lives. And so now what is the U.S. Preventive Services Task Force? Well, they have a group of people that are not oncologists, and they are interested in looking at numbers, and there's no new data, and they're interested in harm. They don't want to harm anybody. So, I mean, it's astounding to me. So they come out with the harms of mammography. You want to know what those harms are? Anxiety. Repeat testing, a needle in your breast. Now, I have had more than one needle. I've had more than one biopsy. And when I talk to my patients, first of all, they pick up my bias, obviously. But when I talk to my patients, and I'm like, you're getting that mammography? So when I talk to my patients, I say to them, the controversy is that it's going to cause anxiety if I call you and say your mammogram's abnormal because you're going to say to me, I have cancer. And I'm going to say, no, I just told you that your mammogram's abnormal. And so that anxiety. So what I said, I was interviewed by the New York Times, and what I said, and I learned something. First, be very careful what you say because it'll come back. So I said very flippantly, I said, well, my patients can live with a little anxiety. They cannot live with a little cancer.